Albuquerque Fire Rescue is, we serve a city of roughly over 500,000 people. We have 764 sworn firefighters that make up 22 fire stations. We serve a population here that has a lot of challenges. Albuquerque has a lot of poverty. We have a lot of people that live here that have adverse health effects of the issues in our city. And so as a all hazards department, we respond to both fire and EMS. A lot of our patients that call 911 are calling 911 because they can't get medical care any other way. So we have several apparatus in our department that run over 5,000 calls for service per year. With those challenges, it's very important to us that we still provide quality services and that we take care of our firefighters. So those are two focus areas for us is quality improvement, quality assurance, and then our firefighter health and wellness is to try to keep our workforce healthy as they're dealing with the challenges that we face as a department.
So the EMS quality assurance process at AFR involves a lot of different aspects of ensuring a high quality EMS system. Ultimately, we're looking at three different aspects when it comes to quality assurance to improve system performance. We look at things such as prospective, things that have happened in the past to be able to fix and make corrections to any issues that we're seeing. We have concurrent issues that we try to catch them in the moment at the lowest level. And then we have retrospective, where we also use data to make data-driven decisions on the care that we're providing to ensure system efficiencies.
As a quality assurance officer, my job is to build autonomous crews. We do that through trust, through proactiveness, on-site training. So let's say an on-scene observation may be a 5-minute talk training session after the call, whereas if it's a medication error, something like that, we'll bump that up to a formal QA. And the last would be QA metrics. It's where we study, let's say, 5-minute 12 leads for chest pain, aspirin giving to chest pain patients, intubation success rate. And that gives us a snapshot of very important metrics that we want to study, that we look at every month to see where we're falling on that. So we all work harmoniously as a team, and I think it increased our efficiency a great deal.
We've also incorporated a lot of public health measures. So during the pandemic, we realized that there was a lot of issues with fentanyl in our city. So we needed to retool our training to be able to address the fentanyl issues that we're seeing. Also, we're having an issue, unfortunately, with pediatrics who are getting their hands on fentanyl. So being able to identify that, treat that within the system. So not only do we try to focus on trends at the provider level, we try to look at the systemic approach as well. So if we're seeing trends around the city, then we really focus our training around gearing towards those trends so we can make corrections for better patient care.
So we have a credentialing process, and I'm actually really grateful for this because it's a chance for either newly graduated paramedics or paramedics who have come into our system, maybe from another agency, to sit down in front of EMS leadership and basically showcase their skills. We give them a book with our guidelines and some easy rhythms to review for cardiac knowledge, our formulary, and once they feel comfortable, they can sit down with EMS leadership and myself to go through some scenarios, talk through the guidelines, make sure they're good to go and safe on the streets. I think it's been really beneficial, and this is actually where we've noticed some trends either from providers who are recently graduated from school, maybe things we need to emphasize a little bit more in training or in our guidelines. And we're bringing those providers up to talk about those cases on camera and share that knowledge and those learning points with everyone else. Those case studies are available on our YouTube channel, so whoever has public access to the AFR channel on YouTube can see our cases and learn from them. They are Albuquerque specific, and they're very much geared towards pre-hospital care in the ALS busy metro environment.
As far as for firefighter health and wellness, it can take a toll on our firefighters from the work that they're doing. We have a behavioral health director that's an expert that can help us navigate what to do with our firefighters to make sure that we take care of them. And it's created a really safe environment for firefighters to come forward if they need help.
The mission of the AFR Behavioral Health Program really is to give comprehensive assessment, care, and prevention to firefighters, their families, retirees, and cadets. We are doing a lot of education for cadets, especially in their first 2 years. We're evaluating them, and as they become probationary firefighters. We're also doing a lot of education for officers in the department, again, normalizing behavioral health. We are doing mind-body fire work, we're doing yoga, we're doing mindfulness, and we've expanded our chaplain corps and our peer program. We have about 59 peer firefighters now on the peer team. And so we're out there doing a tremendous amount of outreach.
We've really worked to destigmatize having behavioral health issues in the line of work that we do. So I'm excited to see how that plays out with just our general well-being of our firefighters now that we have a lot more participating in the program.
I think it's really important as leaders in the fire service to make sure that you are a learning department. Continue to learn, educate your officers, educate yourselves. Your best psychological tool as a leader is always going to be your kitchen table in the fire station. Allow people to talk about behavioral health. Don't minimize it.